Well, good evening, everybody. Welcome back to the show. We're so glad that you are here. Hopefully you had a great Monday, had a great weekend. Some of you probably were off today for President's Day, and hope you took advantage to do some stuff for yourself. Probably some of you were taking care of kids, but that's how it rolls, right? In this episode, I'm going to talk to Pediatrician Dr. Derrol Dawkins. We discuss the importance of medical care for our children. If you're a parent, if you are a grandparent, aunt, uncle, or just friend to children, this is the episode for you, and I am glad that you are here. If you're new to me, I'm Dr. Dwayne Wood. That's Wood with an E. The E stands for endocrinology, and here on the channel, I educate, I empower, and I encourage you to take charge of your health, avoid complications, and create the life you've always wanted, going to that next level. If you're new to me as well, go ahead and put new in the comments, because I'd love to help welcome you with some music and a hand clap. If you have questions as we go throughout the night and throughout the evening, go ahead and put those in the comments in the chat, and make sure you put a Q and a colon in front of those so that I know that those are questions I need to get to. And you'll see an example. I think I put that in the chat when I went ahead and said hello to everybody, but glad that you are here. Tonight is this month is actually a special time because it is Heart Awareness Month. And we have been, over the last couple of weeks, doing heart health. If you've not done so yet, go ahead and get back to our YouTube channel. And on the channel, let me see if I can pull that up here really quickly. On the channel, you will see a lot of the videos that we've done. And for some reason, let's see if we can get that coming in. There we go. All right, there we go. You need to see all my stuff. All right, so make sure you get back in there and see all the videos that we have. If you remember, in November, we did an entire series, Diabetes 101. There are 26 videos in that series that we did. We went live almost every night walking through diabetes. Over the last 2 weeks, we've done heart health, right? So we talked, and actually we started that out when we talked to Dr. Warren Strickland about different types of arrhythmias, right? If you remember that show, go back and watch that one. And then the last two, we did cholesterol. The last one, we did cholesterol versus carbs, that fight that we have that everybody's talking about. And then prior to that, we talked about heart health in general. So make sure you get back over there and that you watch all of those videos that we have done. So once again, glad that you're here. If you've not already done so, go ahead and hit the subscribe button. If you are on this episodes right now, go ahead and give us a thumbs up. Let those people that are in your circle know that we're here, that we are live, that we are doing some stuff. The other thing is, this is Black History Month, and you see me repping, right? That's right, Oakwood University. So I got my shirt on. So if you're out there, if you're from an HBCU, go ahead, put your stuff on. And as I mentioned, for all the shows for this month, I'm going to be wearing my shirt, right? I got my hats, but I've not put those on yet, but we'll go that way. Some shout outs to some people. Those of you who have been engaging with us. Jeff, we are always happy, man, when you come through, because you ask some very, very interesting questions. Linda Masco, thank you for coming through. Janet from Animal Paradise, thank you. Cheryl Wolf, thank you for coming by and dropping some information with us. Grace and Florence, thank you all for doing that here on the YouTube channel. And then back on Facebook, Rebecca Snooty from Birmingham, Annie Sellers, thank you for coming through, and Missy Hassler, all right? Thank you all for all your questions, and thank you for engaging. We want you, if you're on any platform, we want you over here on YouTube as well. So we're growing, we've got a good following over on Facebook, and we want you to help us grow this channel. I think we're at like 910 subscribers here, and we are growing, and stay tuned for some other things that we're going to do. But anyway, having said that, let's see who's out there. I see a special person, so I'm not even going to bring the man up yet, but I'm gonna pop this lady up, Miss Patricia Dawkins. Thank you for coming through, and thank you for hanging out with us. I'm gonna give you a hand clap and some music. we'll tell you a little bit later who Miss Patricia Dawkins is, but she's a special lady. But without further ado, man, let's get into this thing. So pediatrics, so caring for our children is a big deal. And, it takes a special person to be a pediatrician, because not only are you dealing with the pediatric patient, but you also deal with them parents. So Derrol Dawkins in 1969, I want you guys to hear this story. In 1969, when we had the first moon landing, right? Derrol Dawkins wanted to be an engineer, an aeronautical engineer. And a substitute teacher, y'all, said to him, have you ever considered medicine? And that moment, that small question sparked something in him, and he went on to be the person he is today. That led him from Ensley, which is where he was born, right, to Northwestern University, then to UAB School of Medicine, and now after practicing for 40 years, almost 40 years, 39 this year, I believe is what it is, he continues to care for a variety of pediatric illnesses. He sits on lots of boards, and I want you to hear this part. He is also serving as the senior pastor of the New Start Covenant of Grace in North Alabama. He has been the pastor there for 33 years. So I'm not even going to go on in more stuff. There's so much more we can talk about. Why don't we just bring this man up on the stage? Dr. Dawkins, we are so glad that you are here. Man, thank you for coming through and hanging out with us.
Well, it's good to be here. Good to be here, Dr. Wood. And,
man.
To be able to share with you this evening and with all of you out there.
That's right. Yeah, I've been waiting for this conversation. Now, Dr. Dawkins has a special place in my heart because he gave my wife her first job when she finished school. So, thank you for helping to support my family.
You're more than welcome.
Well, man, tell us what's been going on. And I gave this introduction. There's so much more that we're going to talk about. But just share, well, before I do that, the special person that we have on the line actually happens to be related to this gentleman right here, Miss Patricia Dawkins. I'm going to put her back up. And this is a special lady in his life. This is his wife. So, Mrs. Dawkins, we are so happy that you are here to support us and to support your husband. Thank you for coming through. I know she can't respond, but that's good. That's all right.
Oh, yes.
All right.
Yeah,
so tell us.
Celebrate. Yeah, we've been married now about 44 years. Be 44 years this year.
44 years. Wow. So I'm going to ask you, and Ms. Dawkins, I'm gonna have you type in the comments. So Dr. Dawkins, what's the secret to that long, being married that long?
Yes, darling. No,
I love it. Yes, no.
Yeah, seriously, though. Yeah, it's about having a common relationship. First of all, with Christ. We have that common bond. In fact, I met her in church. Actually, in the same congregation that we're pastoring, because that's where I grew up. Mostly after I came back to school, that's where we had relocated to. But I met her in that congregation in the middle aisle, and of course, they don't get married there. Yeah. So
wow. Okay, so you guys go back a ways.
Oh yes.
Okay, so yes, darling, I love that. Well, good. Well, before we jump into it, let's see. We've got some other folks who are hanging out with us. Let's see. I see Angelita Doss. Hey, Angelita, she's new, so let's give her a hand clap and some music. Angelita, thank you for coming through. Florence was one of regulars. We're going to go ahead and give you a hand clap as well, Florence. Thank you for coming through. And of course, the illustrious Mrs. Patricia Dawkins, she's just saying thank you and giving us a smile. Well, so when we talked about you coming on the show, and I tell you, I've been excited. I've been just waiting for this to come. We talked about a bunch of different things, but I want you to kind of help us to understand who Derrol Dawkins was, how you got to where you are. And so I mentioned about the aeronautical engineering. Tell us a little bit about that. So you were encouraged, you were sparked by watching the moon landing, and tell us a little bit about that story.
Well, I guess it goes back a little bit before then. Actually, I've always had an interest in science. I used to have, my mom bought me a little laboratory, and so I had this little chemistry set, and I have one brother that I grew up with, and he was my assistant, and I had had this little chemistry set, and so I always had a little interest in chemistry. And of course, that particular class was a biology class, in fact. And this guy was subbing. And so, and like I said, I always had an interest in science, and always saw myself doing something in that arena. But he asked that question, and I said, well, that's something to think about. And at that time, I guess I was in about the 10th grade, and the teacher would, if I remember correctly, she had one of these big snakes that she would bring to school, and so it was a very enlightening class. But for some reason, she was out, but that particular time, and he came in and he asked me about that. I had always done well academically, and so we started looking, and of course, when I graduated from high school and applying to colleges, I actually applied to medical schools and colleges at the same time. In fact, I only applied to primarily 6-year medical programs. And what that entailed was being accepted. Of course, you had to be accepted to undergrad, but also applying to medical school at the same time. Well, I didn't get into the 6-year medical program, but Northwestern University, along with Boston, I think had a 6-year medical program. So I applied there to Northwestern, got into undergrad, but didn't get into the program. But I love the campus, and of course went on and matriculated there, and I had a marvelous time there. So that was part of that. So I've always had an interest in science. The other little caveat too is that my dad is an entrepreneur. My dad never worked for anyone. And that was the other thing that kind of molded me in terms of the direction that I would go in terms of how I would practice medicine. So he never worked for anyone. I always had in the back of my mind that I would always have my own practice. And so years going forward, I opened the practice, and of course had 0 patients, but the Lord blessed. We had favor and got all kinds of recommendations, referrals from the nurses there at the hospital, and the rest is history.
Wow, that is amazing. What I find interesting is that substitute teacher. I don't know if you've ever been in contact with them again, but they don't. Isn't it amazing how something as simple as a question changed the trajectory of your life, or set you up to do the things you're doing now, and maybe that person doesn't even remember what they did.
Mm-hmm, mm-hmm. And you know what? That kind of goes into what I do on a daily basis. You never know the impact that you'll have on an individual's life. And of course, that's one of the reasons that I went into pediatrics. I thought it would be a time in a person's life where I could make a difference. It's interesting that as I went through medical school, and I, of course, you rotate through all the different disciplines, internal medicine, surgery, and so forth. But it came to mind. I said, well, I think I want to be at a point in a person's life where I believe that I can make a difference and be able to say something. But you're so right. You never know the type of impact that you can have. And certainly that was true in my case. And sometimes it can just be a little word. Sometimes it can just be a little encounter. And so that's why we have to value the times that we have, the exchanges that we have. And over the years, I've been blessed to be able to, what I hopefully pour into the lives of many, and to be able to make a difference. One case in point, also, also participate in our national church organization, and we were up on the campground in Western Pennsylvania one time, and this guy came up to me and said, "Man, I really appreciate you." Evidently, I think he was a physician in New York at the time, and he said, "I'll never forget what you said to me." Now, of course, I didn't remember the details of that conversation, but evidently there was something that I said when he was a youngster, when he was a teenager, that made a difference in his life, and kind of helped him to be able to chart that course. And I think that's important. We have to value the time, and it's all about realizing what God has put in you, and then being a conduit through whom God can flow and be able to be a blessing to others. And it can take different forms. And of course, you mentioned in the intro that, of course, I've been pastoring for 33 years, as well as been in practice almost 40 years, 39 years this year. But I consider all of life ministry. All of life is ministry. It's all about honoring the Lord, but then also hopefully making a positive impact in the lives of others that God allows to come in your path.
Right. Now, I'm glad that you mentioned the pastoring part, right? So we're going to get to that in a little bit more detail. But as you when I got your information and we were talking, one of the phrases that jumped out at me was a holistic approach. When you're in the room and you really, as you were talking here just a minute, I said, okay, come on, we're going to have some shouting here in a minute. But, but when you're in the room talking to parents, talking to the children, teens and so forth, that really is a ministry.
Oh, yes. Oh, yeah, for sure. And we're meeting them right there at their needs, no matter where they may be at one particular point in time. And we take advantage of that. We don't try to proselyte, but we take advantage of that just to pour into their life and to give them perspective, because you have a lot of kids that are hurting these days, and a lot of issues that they are confronting. But not only them, but the parents as well. Sometimes the parents need an encouragement. Sometimes, especially a mom that comes and she's been up all night and the baby's been crying, and they're just whew. I've had all I can take, and sometimes they just need a listening ear, and sometimes that's all that is necessary, is to listen. I don't necessarily have to have all the answers all the time, but I always tell parents, we're here to help you take care of your child, to kind of give you some direction, not to dictate to you what should be done, but to serve as a resource and to guide you along. And of course, we've been blessed in that respect. Having over the years, now we've been able to take care of grandparents. I have grandparents that come in that I took care of. So we're second, third generations deep in terms of patients that come through.
Wow, I love that. And that is really like you said, a blessing to be able to see generations. Now, as a pediatrician, right? And we talked about, the title of this thing is medical care for our children. So as a pediatrician, when you first came out to now, what kinds of issues do you see that we are having today with our kids that you may not have seen in the past in medical? We'll talk about societal here in a minute, but what medical things are you seeing that are a little different than you saw in the past?
Well, when I first came out, there was nothing infectious disease was a big thing. It was nothing for me to have to be concerned about a child with meningitis. It was nothing for me to do a spinal tap and get grapefruit juice coming out of the spinal fluid, looking like that, because that's what we were concerned about. I saw a lot more infectious kind of issues back then. Now, Things have transitioned. I don't know when the last time I had a child with meningitis. It's been a long time. And part of that is due to the fact that we have numerous immunizations now that protect children from a lot of the diseases that we used to fret about. Haemophilus influenza. It was a bacterial infection that can get in the spinal fluid. You can get pneumonias and so forth. And now we give a vaccine to prevent some of the ear infections, the pneumonias that a child can get. So I've seen a turnaround where we don't see as much infectious disease as we used to. Now I have more problems that are more likened to mental issues, and so we have issues with attention issues, behavioral issues at school, even now. With the pandemic and coming out of the pandemic, we have a lot of depression and anxiety. I hardly ever managed or had to be concerned with children or kids having a lot of depression and anxiety, all kinds of stress related to bullying and all of that. Didn't really address that early on in my career, but now that's a question I ask almost every visit that I have. How you doing in school? Anybody been bullying you? Anybody been taking advantage of you? We have to ask those kind of questions now, and so it's more prevalent now. And so we spend more time addressing those kind of things than I ever did in the past.
Wow. And I guess you're right that no conversation about health is complete without COVID coming into that conversation. How did COVID affect your practice? I know, you're seeing more depression and some of those things, but how did it affect your practice? And before you answer that question, I'm going to just break for a minute. Sorry to throw you off, but just wanted to say hello to Tamika Little, who's out there with us.
Oh, yes.
And then we've got Grace, who's coming through, and she says, hello, Dr. Wood, and hello, Dr. Dawkins. Hey, Grace, thanks for coming by. But yeah, so
our practice administrator, actually.
Oh, okay, Tamika Little. Hey, thanks for coming. I got to give you another music out there, Tamika, because you helped this man keep going. Okay, good. But yeah, so COVID, right? How did COVID affect how your practice worked? Not necessarily the things that you necessarily saw, but how did it affect how you did things in your office?
Well, I think what it did, it caused us to kind of relook at some things. It caused us to kind of re-examine how we did things. And I think that in my experience over the years, that have always been turning points in the practice that kind of where we had to kind of reassess what we did. Even before COVID, we had to reassess how we did our documentation. Of course, when I started in practice, we had charts. We had paper charts. I had a whole room and then another back room full of charts. But then about 1999, we started EMR. We've had EMR, electronic medical records, since about that time. Now, what's that? About 23, 24 years. Well, that caused us to kind of rethink how we did things. I used to have chart racks to put the charts in. Now we have computers, laptops that we take in the room. So I use that as an example. There are always things that cause us to kind of rethink, reassess how we do things. Well, when COVID hit, with the emphasis on isolation and on the emphasis on, okay, we have to social distance or physical distance, we had to re-examine how we did things. So we had to restructure our intake process in terms of how patients came into the office. Well, it just so happened that we were already going to jump into telemedicine. We were already committed to that because, again, with the behavioral issues and so forth, we all already saw the value in being able to offer telemedicine. But when COVID hit, that kind of accelerated that process. And so what it did, we had to change even how we brought patients into the office. And so even now, we have continued that whole process because patients come in, they register online. We were always trying to make that transition from paper to completely digital processes. And so we were kind of half and half. It was kind of a hybrid type of thing. But of course, when COVID hit, you couldn't be exchanging papers and pencils and pens and so forth, and having people to sign in. But now we have platforms now where people register on their PDA device, and they can do it at home before they get to the office. And so now we still encourage individuals to stay in the automobiles, and then we call them in. So we now don't have a lobby full of people, because even though from the beginning, we used to have a separate place for well visit, separate side for sick kids. But of course, with COVID, all that went away. You just couldn't have a whole bunch of people there in your reception room, because anybody just kind of clear their throat, they're going to be looking at somebody. What is going on? So we had to reorganize how we brought patients in. And so now, like I said, they register in the car, and then they come right into the triage room and then into the exam room. And so even the way we structured our office, the Lord has blessed us we have about 15 or so exam rooms here in the office. And so we started seeing patients that were potentially COVID. They would be on the one side. We had a glass enclosed area that we used to would do asthma treatments, and we would put them over there. Then, of course, there were some instances early on, we examined them out in the car, especially if they were coming in just for a test or they were a little bit older. We would see them out there in the automobile. So those kind of things kind of changed how we did things. But it provided opportunity for us to streamline those processes. And so oftentimes you say, well, COVID was just the pits. But I think it forced us to be able to re-examine what we're doing. I think that that's what we have to look at in life. Life is about looking at opportunities. So you can have opposition come, you can have things that may happen. And so you have to look at it. Well, what's the opportunity here? How can I better do what I'm supposed to be doing?
Love that. So COVID did a lot of things. So I want to pivot a little bit. So tell me, or tell us. So we're going along. So we went to Northwestern. We got UAB under our belt. We've got our pediatrics going. Tell me a little bit. How did the ministry come in there? Where did that come in, and how did you begin incorporating that into what you do as a person?
Well, I always had a desire and a gift of teaching God's word. And so I think I'll go back even to Northwestern. I was blessed to when I went to Northwestern. My mom located a congregation there in Evanston, Illinois. And I never will forget that day where we had gone, my mother and I had gone up to the school, and we went into the church, and I saw my pastor there, Pastor Carl E. Flew-Ellen. And he was an integral part of my life, because during that process, he even came over to my dorm room one time. They took me under their wings. You talking about going, in college, you had on Sunday, everything kind of closed down. So you were kind of on your own. And so the saints there took care of me. They would invite me over. I had supper at their table many Sundays, and so that was a big part. And so he involved me in the ministries there. I used to teach Sunday school there while I was there at Northwestern to kids. I think they were about 7 or so years old at that time. And so we were there, and then I was involved in the ministry where I started chairing services and things like that. And so that was kind of like the beginning point where I was involved there in the life of that congregation. And then, of course, when I came back to Birmingham, I was involved. I was selected to be the chair of the youth department for our district. That is a consortium of different congregations throughout Birmingham. And even before then, even before I left, I was always involved in the life of the church, in the life of our congregation. And so that was always an integral part, because I committed my life to the Lord when I was about 15 or 16. And in fact, when I was at the church where I grew up, man, the other guy, we used to say, well, when we get to 12, we're gonna get saved. Because that was a time where Christ, the story unfolds. That's where we pick up his life. Say, well, when we get 12, we're gonna get saved. And so he was the pastor's son. So I've always had a relationship. I always had been involved in the life of the congregation. I had a personal relationship with the Lord about 16 or so. So I was kind of properly positioned when I went to college. But then I was groomed. And so when I came back, I began teaching. That was about 76. So then we began I became, like I said, engaged in the youth ministry. And so part of that was providing studies, and how I used to start provide studies there during that time. And so actually that was when I met my wife. She was a secretary. I was a president. Can you imagine? And so we were involved in that ministry, used to go to the jail ministry and so forth. So that kind of dovetailed. And then we were without a pastor at one point. And so I carried on the teaching along with another minister there. I used to go to the health department on Wednesdays. And it was a little bit, this is after I started practice. I did that up until about 91. But I would prepare my Bible study during that time. Can you imagine? Because it was a little slower than my practice. And so that was a time where I would do the work on my study. But even when I was at Children's, I was involved in teaching. And so and when I served as chief resident, I was involved in the teaching ministry there at the church. So that kind of evolved. And then when we were without pastor, I said, well, I believe that the Lord is calling me. I told one my former pastor. Actually, he was the father-in-law of the pastor that I had there in Evanston, Pastor Williams, and I told him that I thought that the Lord was calling me to ministry, and so the rest is history. And then of course we became involved there and participating, and it lets you sharpen your teeth on the saints. they were always, I guess they had to be patient. You know how it is. You get all the blessing. Right. So that's how I started. But then in 90 we were without a pastor, so I said, okay, I'll make sure things kind of I'll provide a bridge so that things don't just fall apart. And of course, I served as interim for a minute, and then over 33 years later, we're still here.
Wow. That's an amazing story. And you did this all while you were studying, training, and all this started at least at that time, and then you continue that through the practice. Wow, that's amazing.
Oh, yes. Like I said, it's always been a parallel. It's always been a parallel, and I don't segregate one part from the other. Like I said, all of life is ministry, and it's what God has gifted you to do, and God has always gifted me to be able to have, like I said, I always had a love of science. I love people, and so those two kind of coincide, and that's why I went to pediatrics. Again, love the kids, and of course, hopefully, it's at a point in time in their life where you can make a difference. Because when they're older, all you're doing is just kind of managing stuff that's already established.
Oh, buddy, don't I know that?
I know you know that.
I love it. Well, we've got some other folks that have dropped in. Tangi Silman. Tangi, thank you for coming through. So here's some hand caps and music for you. And then I see another name Dawkins. Gwen, Miss Patricia Dawkins said that Gwen Dawkins is also watching and sends a little hand wave for you. So Gwen, here's some music for you as well. And this is an amazing.
I have to say, she's why I'm here.
That's Mama.
That's Mama.
Hey, Mama, how you doing? Come on. Well, Mrs. Gwen Dawkins, thank you so much for coming through and supporting us and supporting your son. Hey guys, we are talking with Dr. Derrol Dawkins, a pediatrician, a pastor who's been practicing for almost 40 years, who's also a senior pastor of the church there in Birmingham. We're going to come back and talk to him in a minute, but this is a great place for us to hop over and to do our amazing question wheel. So let's do that right now. All right. So if you are new to us, this is our amazing question wheel. You'll see that there on the screen. We've got some questions that we're going to spin the wheel, and then we're going to answer the question here in just a minute. We've got a couple of rules for the question wheel. Number one, if you would like your question to show up on the wheel, go ahead and send that in to us. You can put it in the chat. You can send it on to any of our social media platforms. You see them there on that medicine bottle, LinkedIn, TikTok, Instagram, Twitter. We've even got a Twitch account that we've just recently started. So you can connect with us on any of those. Just send us your message and we will include that on the wheel and you will get a shout out. We'll shout you out like we did earlier in the show for those that have been involved with us. So I'm going to spin the wheel. We're going to get to the question and I've got 40 seconds to answer the question. Okay, 40 seconds. All right. Not to start answering the question, but when I start my answer, I got to give it 40 seconds. It's got to be a real answer, something practical, something that you can use. So let's go ahead and let's spin that right now. The other thing is when we're done, I'm going to clip that out, create a reel, a short, whatever platform, and we're going to post it on our social media platforms. And when you go out and you find it, I want you to, in the comments for the video, put hashtag I was there. Right? So hashtag I was there, because you're seeing us create this right now live and on the air. Even if you are watching this on the replay, you can put hashtag I was there as well. Okay, so let's go ahead and spin the wheel and let's see what question we have. And round and round and round it goes. Where it stops, I don't know. Looks like it doesn't really want to spin there. Come on now, come on. And okay. It's like our internet is giving us some issues with our amazing question wheel, but it looks like it's stopping. Come on now, come on. Okay. It finally made it. Finally made it. So, what are the symptoms of a heart attack? What are the symptoms of a heart attack? So, let's get 45 seconds on the screen, and then I get to answer that question. So, what are the symptoms of heart attack? You get that? Okay. All right, here we go. So, 45 seconds on the screen, and we're going to get our answer. So, what are the symptoms of a heart attack? Well, the most common symptom of a heart attack is chest pressure. Most people think that it's pain, but usually people say that it feels like there's significant pressure on the chest, almost like an elephant sitting on the chest. You can have palpitations, diaphoresis, so sweating, heart racing. You can have jaw pain or pain that radiates down the arm, the left arm, and also numbness and tingling. Those are the common symptoms of a heart attack. All right, so did I make it? Yeah, I got it. So I still got 10 seconds left. There we go. Awesome. So that's our question wheel for tonight. Well, I am so excited that we have Dr. Derrol Dawkins, who is on with us, who has been an amazing story, right? That you guys heard the story. So let's go back and let's get back with him and let's continue our discussion. Dr. Dawkins, once again, thank you for coming through and hanging out with us.
Sure. My pleasure.
All right, so let's see. We've got some people who popped in. So let's grab some of these. So here's a special lady, special in my life. This is the other Dr. Wood, Dr. Charmaine Wood. She says, hello to everyone watching. Welcome to our new guests. Great show. Thank you, Dr. Dawkins, for sharing your experience with us tonight. Yeah, thank you for being here, Dr. Charmaine. And then we've got Grace. She said, great show. Always, Doc. More power. Thank you, Grace. And then Angelita Doss, he says, awesome show. Angelita, thank you for coming. I don't know, did I give you a hand clap? Let's do that right now.
That's one of my church members now. You got to give her a hand clap.
Oh, come on. Oh, and some music. So that's one of the church members. So Angelita, always glad when new people come by and hang out with us. So Doc, let's get back to our discussion. So there are a couple of things that I want us to make sure that we cover, right? Number one, this is Black History Month.
Right.
And you are in Birmingham, Alabama, right? So Alabama, big in the civil rights movement. Birmingham, big in the civil rights movement. Tell us a little bit about your interaction with the Black community and how is our care for our Black children improving? I know that's a big question. Let me have you take a shot at that one.
Okay. Now, as far as care, I think one of the big challenges is access to care. We are blessed here, of course, in Birmingham, that we have just about almost an office on every corner, almost. And so we have the health department, we have private practices, we have our children's, which has absorbed a lot of the practices, and so there are a lot of practices available here in the metropolitan Birmingham area. Still, with that, you still have some problems with access, transportation issues, where there may be an office there, but can I get to the office? And then, of course, we have instances where, especially with young parents, they may have jobs that will not allow them to take off a lot of time. And so subsequently, they cannot get to the office. And sometimes with acute illness, you see our emergency rooms loaded up. And so that can be problematic there as well, because if they take off from the job too much, then they get docked. Well, that's Birmingham, but let me say this also, that here in the state of Alabama, that we have a situation down in the Black Belt, for instance, where there is often not even a pediatrician in the whole county. Kids will have to go 30, 40 miles in order to get care. Of course, they have the school-based care and maybe the health department, but as far as having access to pediatricians in an office setting, that's kind of sparse and far between. And so there are some instances, and we partnered with one ministry. With Dr. Ford and her husband, where we go down to used to go down occasionally with them to the Black Belt to serve those populations. But that is a contrast to what we have here in Birmingham. So that again, we have problems with access to care there, where you don't even have a doctor in the whole county, and they have to go to a neighboring county to be able to be seen. But I think that by and large, it has to be. I think it's improved. We have care, and then of course we have. I think 66% of the kids in the state of Alabama are on Medicaid. So, of course, those are some other issues in terms of having proper insurance. But for the most part, most of the kids will be covered not with that, but with all kids. And then, of course, you had your commercial insurers as well. So that's always been a challenge. And then, of course, I guess personally, of course, you asked me about the children and providing care. But historically, here in this city, it used to be a time where you had to go through the back door in order to be treated, and that was just one of those realities. And that's why I wanted to form our practice so that it provided access in a setting, a professional setting, in a setting where kids could see themselves and then can see how that care is being delivered. Because I guess when I grew up, my mom always had us going to physicians of color, and we had that privilege, and we had a black eye doctor, black medical doctor, even black surgeons. And she worked at the hospital. She was a switchboard operator at that time, back in the early 60s. And so we had that kind of exposure. And so I think that that made a impression, upon us. But that was something that's always been, in my mind. And I wanted to be able to provide a setting where kids could come in and they could feel welcome and they could get quality care.
Love it. So as we are getting to the end of Black History Month, one of the things that one of the questions I get a lot, and you mentioned this earlier, is how important are vaccinations to the care of our children?
I think it's critical. I think it's as I alluded to before, there are a lot of illnesses that we used to see that we don't see now. For instance, even polio. I've never treated a case of polio. But we have given the polio, we give the polio injection now. It used to be an oral thing, but we got it down so low that we started having risks from getting polio from the live vaccine. So we have now the attenuated and we get the injection. And so I think vaccines are important. Unfortunately, it gets a bad rap. And a lot of misinformation, in some instances disinformation, things that are purposely said to kind of decrease the vaccination rate. But I believe, in my personal experience, I've seen a change in even the things that we have to treat. And of course, no kids like to get a shot. But but it's imperative, it's critical to get vaccinated. And of course, we've seen this with the COVID most recently, and we have our flu vaccines, and those are subject to a lot of again misinformation a lot of times. But we have a whole plethora of just routine vaccinations that we give now. Vaccines to prevent polio, vaccines to prevent certain types of ear infections and pneumonia, sometimes some diarrheal illness, a lot of different vaccines. And you say, well, why do we have to give all those vaccines? Well, I think it's reflective of our standard of care. All you have to do is just look at some of those countries where you don't have vaccines. Kids dying of tetanus. In early childhood, all those kind of things, and so I believe vaccines are critical, and they are part of what we do. They're a mainstay of what we do as pediatricians, providing that preventive care, and that's by and large so important.
I love that. I love that. And you mentioned a word there, preventive care. The other component of that is the well-child visit. Can you explain what a well-child visit is? Obviously vaccines are in there, but what is a well-child visit, and how important is that to the medical care of our pediatric population?
Well, well-child visits are, again, that's one of the mainstays. The reality is that you have to look at it from this standpoint. Oftentimes, as far as illnesses can come and go depending upon what's there in the community. But well visits are critical. We provide, again, that preventive care. We do what we call anticipatory guidance. We're talking with parents and trying to give them insight to what may happen down the road. For instance, at my 1 month visit, I talked to them about fever. I say, well, look, fever is not going to cause any brain damage, because when the little one gets fever, his brain is going to get cooked. And nothing be further true. I explained to them that it may take temperatures up to 107, 110 when you get brain damage. You're not going to ever get that. So I explain in an anticipatory manner. In other words, I'm telling them something before it happens, so that if indeed it happens, then they have a little bit more to hang their hat on. We give them a little guideline and tell them, what kind of fever management to do, what not to do, because there's some things that we used to do we don't do now. Don't give them an alcohol bath. We don't give them aspirin anymore. So we anticipate those things. So part of the preventive care is anticipation. We do developmental assessments. We have a whole array of things that we're assessing. In fact, we go back to what COVID did. COVID forced us to be able to do a lot of things online and in a form where parents can do it at home. And part of that is a screening tools where we ask a series of questions. And sometimes it can be baffling to parents. Say, why I got to answer all these questions? Well, we're asking them about smoking. We're asking them about lead exposure. We're asking them about and then later on, we're asking them about, well, have you talked to your child about sex yet? We're trying to get a field. Is there any food insecurity? Is there a problem with getting access to food? Because some of our parents, some of our families are in food deserts, and so we have to ask those kinds of questions to identify. And so the purpose of the well visit, not just to get shots, but also to make sure that they're developing socially, that we want to make sure that child is positioned so that they can make full potential of their capabilities. That's the whole purpose. And we have several, they after coming out of the hospital, they're going to come in for their first visit, and depending upon the child's weight, we'll see them at a few days of life, and then maybe at a month maximum, then at 2 months and 4 months and 6 months, 9 months, 12 months, and then 15 months, 18 months. And before you know it, they're at 2, and then every year after then. And so the other thing that's important there, especially with black men per se, I tell my young men, I say, look, the reason we're doing this well, after you leave me, you need to continue to go to the doctor every year. You need to get your preventive care, because as you're aware, a lot of times we'll have a lot of things that will occur, but then if they're not caught early, then they have to you have to do a lot more, and there's a more worse outcome with those particular illnesses. And so we try to get in their minds that, look, this is something that we have to do every year. And so hopefully after they leave me, they're continuing to do that. So we're trying to ingrain in them that the need to get care on a consistent basis.
And that really is the key, that consistent follow-up, right? Because as you said, there are things that if we're not consistent, we miss, and it has a lot more that we've got to do down the road than if we had caught it earlier, then we could have taken care of that.
Mm-hmm.
Yeah. So Black History, and I know with Black History Month, we're going to say that when you were coming through medical school, right, residency and setting up a practice, what was that like to be a Black physician in Birmingham?
Well, I'll go back to medical school, and I was blessed having gone to Northwestern, because like going to Northwestern was almost like going to medical school. In fact, the texts that we used in undergrad were the same ones that I had the first year of medical school. So I was blessed in that respect. However, I saw a lot what I used to call benign neglect. There were a lot of attrition that first year in medical school, where a lot of my fellow Black students didn't make it. We lost I think maybe 30%, 40% out of that first class. And so as a result of that, we went to the dean at that time, myself and a few other students. And we said, we need to do something. We need to create a summer program or something to kind of help the students that are coming in, because they might not have had a privilege to be able to do that. So it wasn't an overt thing, but it was like benign neglect. Just didn't do anything. Now, and of course, as you're aware, I as far as residency, I was blessed. I didn't really, I don't believe, experience just overt racism. I was the first Black chief resident there at Children's of Alabama. In fact, I believe the first Black resident in the whole UAB system. Because, of course, Department of Pediatrics was part of that. But I was blessed to be tapped there. Now, unfortunately, I don't know how many more we've had since then, but it's much better now. But I believe that that whole culture, though, and I'll give this little caveat. And we have to be careful and don't think that you are exempt just because you're in a particular position. I never will forget. I was serving on the board of health, part of the Jefferson County Medical Society, and we had at that point I was serving on the board, and we used to have meetings up at the club. And on one occasion, the meeting had climaxed, and I was getting ready to go out, and I was there with all the other fellow physicians, and this female doctor asked me, "Can you get my car for me?" Now, keep in mind, I'm there at the meeting. I'm on the board, serving on the board at that time, but she asked me to get a car, and said, well, I tried to be polite. I said, well, no, ma'am, I'm Dr. Dawkins, and I am not able to do that. And of course, she turned beet red. Those are the kind of things that we still get exposed to, and that we still have to deal with. Uh, and of course, as I was coming out of residency, I didn't get a whole lot, maybe one, didn't get a whole lot, even though I had service chief, didn't get a whole lot of invites to say, well, I want you to start a practice. Although in my mind, I really wasn't really that interested in that, because I always had in my mind that I wanted to have my own practice. My dad never worked for anybody, so I always had the idea that I'm not going to work for anybody either. I'm going to start my own practice, and so we did, and of course, again, the rest is history. Of course, I did some little things there at the health department to kind of smooth over things in the process. But yeah, it's still real. It's still real, and of course, I can tell you all kinds of stories growing up here in Birmingham. From driving from Clanton, and the policeman stops you and asks you, "Is this your car?" At that time, I think I was driving a Mercedes, and and I said, "Yeah, it's mine. I got another one at home too." And so, but those are kind of things with, and that's a reality that we have to deal with. There's just that assumption, and so even when I was in high school, got called the N word there because I went to a predominantly white school, but I always prefer to respond with excellence. So that was a ninth grade, and then fast forward to 12th grade, I gave the valedictorian speech. Because I was among the few that graduated with a 4.0 grade point average. So I had the honor of giving the valedictorian speech. But in the process, Dr. Wood, I got so many awards that the principal, because there was going to be an uproar, he had to present some of the awards in his office in private. Although I had, gotten the award.
Wow.
That's what I had to do. Those are the kind of
Wow.
things you grow up and you deal with. But I choose to respond with excellence, and that's you can get bitter and so forth, but you can do what you have to do.
Wow. 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 So what a life you've had, and love that you are still going strong and taking care of our young people. Really appreciate that. What if you had to say one thing to a mom, dad who's out there, they have a child, whatever age, in terms of health care for that child, what is one piece of advice that you would give them?
Well, one piece of advice. I think that you have to appreciate the nature of the child, and the word says, "Train up a child in the way they should go, and when they depart, when they grow old, they should not depart from it." Well, sometimes you have to appreciate the bent of a child, and sometimes if we're not careful, we'll try to mold a child in a direction in which they are not prepared, or they're not designed to go. In other words, for instance, your dream might have been to be a pro football player. So you get a son and say, "Okay, I'm going to make sure that he's able to play he's going to play football." Well, he may not want to. That may not be his thing. So I think the thing that we have to do is to be wise, ask God's guidance and direction, and then to discern what's their bent. What are they made for? And then help them and develop them. And you want to do everything that you can to enable them to reach their fullest potential. I think that's one of the most important things. And then, of course, provide a atmosphere, provide them with the opportunity. That is, you want to make sure that they have good health. And then I believe that providing that gives them a basis, making sure they have good nutrition, teaching them how to make good choices, good decisions, and so forth.
All right. Love it. Love it. Love it. Well, Dr. Dawkins, I mean, this has been an amazing conversation, and I hope you will allow us to bring you back, because there are some other things that we want to talk about, and maybe just come back and do just a question and answer. People come on and they, have some questions in the pediatric space. So I'd love to have that. But why don't you take a moment right now and tell people, if they're out there, how can they reach you? How can they become a patient of yours if they're in Birmingham, if they're watching? I don't know if you guys are doing long distance online stuff, but whatever, just take a moment right now and tell them that.
Okay. Well, we can go to our website, Metro Pediatrics .net. I think that's right. I always have
.org.
to make sure. .org. Thank you. I think that's the church. .net. .org. And then there's an interactive piece on there where you can ask questions and plug into the practice. And of course, we have a anytime pediatrics platform, so we can do long distance things. We try to have relationships there, but we have that capability as well. And then of course, our telephone number, I see you have the 634-3461, and also we have 941-1414. And they can get in touch with us. And so we have a great team. I have some new physicians, pediatricians that are coming on board. And so we are expanding. We're now 5 providers. We have 2 nurse practitioners and 2 other pediatricians beside myself. And so we are poised. We are poised for the future. Metro Pediatrics, we like to say, is going to go on into perpetuity. That's one of the things that's always been a heart of mine, to go on. And so we are poised now. It's not just me, but we have other providers here as well, to be able to provide excellent care for your children and your adolescents. We go from birth up through college, and sometimes through grad school as well.
Awesome. I love it. Well, thank you once again, Dr. Dawkins. Thank you for coming through. Thank you for hanging out with us. And if you hang on for a minute, I'm going to go ahead and close out the show, and then we'll talk a little bit more.
Okay. All right. Great.
All right, guys. Well, we are so excited to have had this conversation with Dr. Derrol Dawkins, pediatrician, pastor, almost 40 years of pediatric practice and 33 years as a pastor. And like I said, we're gonna have to bring him back to do some more things. Right now, why don't we hop over and let's do our thought of the day. All right. So our thought of the day is this: everyone wants happiness and no one wants pain, but you cannot make a rainbow without rain. Have mercy. I'm not even sure who said that. I got that. So once again, everybody wants happiness, but nobody wants pain. You can't make a rainbow if there is no rain. What does that really mean? Right? So as we are going through our lives, there are so many things that have happened to us. And I'm going to say some of the things that you guys have experienced out there, I can't even begin to understand and begin to comprehend. There has been so much that has impacted you, impacted your life, whether it's your health, family issues, mental issues, societal issues, stuff on your job, stuff on your house, just so many things. And you are looking at life and saying, man, this is not fair. This is so hard. This is so bad. And my heart goes out to you. Let me pause. My heart goes out to you. One of the things that I've heard is that the things that are happening to us, while heinous, they're preparing us for something. I don't know what it is. And I can't feel your pain. I don't mean to minimize your pain. I don't mean to make you think that your pain is nothing to, jump up and sometimes scream about, because sometimes you got to scream, you got to cry. But there's a purpose. And the question for all of us is, how do we find the purpose in the things that have happened? Whether it's a health issue, as I said, a marital issue, a parent-child relationship. You may have gone bankrupt. Your house may have flooded. Your house may have burnt down. What's the thing that you are getting from that? And as we are making that rainbow, y'all, remember this year, we're not letting stuff happen to us anymore, right? This is the year that we are taking charge. All the baggage that we're bringing with us, no, we're cutting that loose. And we're saying, what are we going to do in 2023 to make ourselves better? What are we going to do to make our health better? What are we going to do to make our finances better? What are we going to do to make our relationships better? What are we going to do to be better? Because that's what we do, right? We educate, we empower, and we encourage you to take charge of your health, your life, avoid complications, and create the life you've always wanted. If that's what we do, that's what I do on the channel. And I am so glad that you have been here, that you've spent some time with me. If you've not already done so, go ahead and subscribe to the channel. If you don't have an account, create a free account. Hit the subscribe button and also hit the notification bell so that you will get notified when we do things. But this year, we're making rainbows, and there may be some rain coming our way, but we're not scared of that, right? We're not scared of that. We want the happiness. The rain's going to come. But ultimately, we're looking for them rainbows because we're taking charge of our health and taking charge of our life. And that is our thought for today. All right. Yeah. See, let's see. Such an awesome broadcast. Thank you, Ms. Patricia Dawkins. Thank you for coming through. And we're going to have both of you on one day, Doc. We're going to bring the whole family on and do that. And Patricia Dawkins says, such an awesome broadcast. Thank you once again. She gives some hand claps. She said, pain is preparation for our destiny. Oh, yeah. Oh, yes. I'm going to write that one down. I'm taking that one, Mrs. Dawkins. You may have said it, but I'm keeping it. And then Angelita Dawes gives us some hand claps. So guys and gals, thank you once again for coming through. As I said, share this with somebody who's out there. If you're looking for a pediatrician, you saw the contact information. If you're in Birmingham, if you're in Huntsville, if you're anywhere surrounding, and he said they can even do distance things, right? They want to build a relationship, but reach out to them. It's an awesome practice. They've got some awesome providers. Go ahead, and when you call them, let them know that you heard about them here on our show. Okay, so let them know that it was a good thing to be here. So go on out and find that clip that we created. Is going to be on our social media platforms after midnight, and make sure that you write in the comments #IWasThere. Once again, this is Dr. Dwayne Wood. That's Wood with an E. The E stands for endocrinology. Here on the channel, I educate, I empower, I encourage you to take charge of your health and your life, avoid complications, and go to the next level. Keep an eye out. We are going to be doing our Sugar Buster. It's coming. It's starting. We're going to start that in March. Okay. We're going to probably start it March the 15th to give you guys some time to kind of get ready, but you'll be hearing more and more about that. So Sugar Busters, if you're interested in losing weight, if you're interested in managing your diabetes, if you're interested in just being healthier, right? Sugar causes so much inflammation, and we want to make sure that we are improving that. Keep an eye out for all those things. If you've not already done so, go to our website and make sure that you are taking advantage of all the things that we have on there. Let me see. Let me pull that up here really quickly. So Dwayne Wood MD. Let's get that. Dwayne Wood MD. And make sure you get over to our website, and that you should see that there on the screen here in just a minute, I think. Boom. There we go. Right. And you get our free download, 7 Keys to Success. Right? Learn how successful people create the life they want. You can get that there on the website. It's a free offering that we have, and you don't have to buy anything. There's no upsell. It's just, you get it. and that's what it is. If you scroll down on our page, you will see our podcast. So if you got folks who don't want to watch video, which we want them to watch video, but they can get over there and they can see all of our podcasts. And if you go, what am I pulling? I keep scrolling. There you go. There's our podcast right there. The battle between carbs and cholesterol. How does heart disease affect the body? Why do you use radioiodine ablation, and what are the side effects? So we've got a bunch of stuff. I think there are like 60 episodes. Okay, you can get over there. And then, of course, if you are on the website, you will also see our blog. Right. And we're getting a lot more offerings there. So many different things that you can avail yourself of. And there's all this stuff right there on the website. These are free offerings. If you want to work with me personally, you can also sign up there on the website. So thank you. Good night, everybody. Have a great evening. We will see you at the next visit, or not next visit, next episode next week. Make sure that you are here. Bye-bye.